In the field of healthcare, workers come from all sorts of backgrounds, many from working families, middle-class homes, or even families that already have workers in the profession. Few come from the humble beginnings that Vivien Thomas has. Coming from poverty, living in the South at the height of Jim Crow, and being paid as a janitor for most of his career, Vivien Thomas's rise in healthcare is one of struggle, devotion, and perseverance. His story can serve as a tale that no matter how stacked the odds are against you, one can and does succeed, paving the way for others to follow. Here's the story of Vivien Theodore Thomas, from janitor to doctor. Vivien was born in Lake Providence, Louisiana, on August 29, 1910, the grandson of a slave. His family moved to Nashville when he was 2, and that's where he spent the remainder of his childhood. From his early life, he attended school and worked alongside his father in the carpentry business. He graduated high school in 1929 and was working in a private infirmary to save money for college. He enrolled as a pre-medical student at Tennessee Agricultural and Industrial College. Shortly after, however, the stock market crashed, closing his bank and wiping out all the savings he had. He was forced to drop out of school. Using some connections he had made, he was able to secure a job as a laboratory assistant with Dr. Alfred Blaylock at Vanderbilt University. On his first day of work, he assisted Blaylock in performing a surgical experiment on a dog. After they were finished, Blaylock said, "Okay, we'll do this tomorrow." After a few weeks of working, he gained the trust of Blaylock, and he was performing surgical procedures on his own. This job was only supposed to be temporary. However, due to the low salary he was making, the instability of the job market, and his savings being wiped out a total of 9 times during the 1930s, he stayed with Blaylock and did not attend medical school. In this lab, Blaylock and Thomas performed extensive work contributing to the knowledge of science. Their work on hemorrhagic and traumatic shock would lead to more advanced research in crush syndrome, a condition where damage to the skeletal muscle results in major shock and kidney failure. They showed, with proof, that this was caused by the loss of fluid outside the vascular bed, disproving the previously held theories that toxins in the blood cause shock. Their work led to further research that saved thousands of soldiers in World War II. At this time, they also started to work on the heart, breaking medical taboos. By 1940, Blaylock, with the help of Thomas, was at the forefront of American surgery. He was offered the position of chief of surgery at Johns Hopkins in 1941. When making his move, he asked Thomas to come with him, and he agreed. Thomas and his family arrived in Baltimore that June and experienced a severe housing shortage alongside racism worse than in Nashville. An example of the racism Thomas had to face was while at Johns Hopkins, the institution had a belief that black men should only be janitors. Thomas felt that he was getting too many dirty looks while wearing his white lab coat and actually stopped wearing it when moving between rooms. In addition to this, he was only being paid a janitor's salary. Despite this, he pressed on and even supplemented his income by being a server at Blaylock's parties. In 1943, Blaylock was approached by a pediatric cardiologist seeking a surgical solution for blue baby syndrome, a condition where blood is shunted past the lungs, creating oxygen deprivation in infants. Realizing the solution lay in their previous work, albeit for a different purpose, Thomas and Blaylock got to work. Thomas was tasked with creating a blue baby-like condition on a dog, then correcting it via a shunt. In the next 2 years, 200 dogs were operated on. Thomas replicated 2 of the 4 abnormalities associated with the syndrome. After showing the correction was not lethal, Blaylock commented, "Vivien, this looks like something the Lord made." Because it was not lethal, this convinced Blaylock to perform the procedure on human patients. On November 29, 1944, Blaylock performed the procedure on 18-month-old Eileen Saxton. Because no instruments for cardiac surgery existed, Thomas himself created them in the lab. At Blaylock's request, and against all norms, Thomas coached Blaylock through the procedure. They were successful and performed the surgery many other times, although Blaylock and Towsing were the ones who received the credit for the procedure, not Thomas. Today, this procedure is known as the Blaylock-Thomas Tassing Shunt. In 1946, Thomas finally got the pay raise he deserved. With the help of Blaylock, his pay was raised from that of a janitor to the highest paid assistant at Johns Hopkins, and by far the highest paid African American. After this, at Hopkins, Thomas began to train the next generation of surgeons, many of whom began to credit their ability to Thomas's instructions. Surgeons creating life-changing procedures all found it easy to do thanks to Vivien Thomas. After 34 years of partnership, Blaylock and Thomas's relationship came to an end. In 1964, Blaylock died of cancer. Thomas would remain at Johns Hopkins for an additional 15 years, serving as the director of surgical research laboratories and mentored Johns Hopkins' first black resident, Levi Watkins Jr., whom Thomas helped with his work with the first automatic implantable defibrillator. The same surgeons who Thomas trained and mentored throughout his career came together in 1968 and commissioned an oil canvas painting to be made of Thomas and put in Johns Hopkins. In addition to this honor, in 1976, the university presented Thomas with an honorary doctorate. They were not allowed to present him with an honorary medical degree due to some laws. However, this honorary doctorate allowed his students to call him Dr. Vivien Thomas. After 37 years of working there, he was appointed as instructor of surgery to the School of Medicine. Thomas would serve this role for an additional 3 years before retiring in 1979. He passed away a short time later on November 26, 1985, aged 75, due to pancreatic cancer. He never operated on a human patient. Vivien Thomas inspires me, and he should inspire all of us. In a time when he was discriminated against, kept having his savings unfairly wiped out, and not receiving the credit he deserved, he kept on, working harder than ever, and persevered. Vivien was a victim to so many injustices, yet he never let this word define him. His mentality did not show he was a victim, but rather a fighter. Instead of giving everything up at the first signs of hardship, he picked up his cross and kept right along. In a modern-day world so quick to blame and make excuses, Vivien is a refreshing reminder that even in the face of injustice, one can succeed. That doesn't mean the injustice was okay. Rather, it shows that hard work and dedication at the end of the day will be recognized. Vivien Thomas is my healthcare hero, not just for what he's done for medicine, but for his unbroken character.
Do you feel the connection?
Are you sure you did this, Vivien? This is like something the Lord made.